Are you ready for AI? Are you equipped enough to survive through the changes that are coming? Hello, I am Dr. Bhavesh Patel's AI avatar. He sent me to do this talk to show you the capabilities for improving the patient experience in healthcare. He does have some disclosures that he wears many hats, including advisor and investor roles in the companies listed here. We now live in a world where creativity can be explored. Today we focus our attention to the most valuable and precious thing in the world, your child's health. You have dreamt and built a story of their future already. For some it might be in the stars. You've built such expectations of a wonderful future for your child. However, the healthcare system still practices from the 1950s with paper records, letters for appointments full of jargon. We must evolve and improve our emotional intelligence with delivery. I'm involved in a global quality improvement initiative in surgery where we focused on doing normal activity well. Our infection rate halved. The consequences were even better. Reduced readmissions and waitlist reduction. One of the main things we noticed was with increased digital communication, there was improved trust and engagement. We discovered ongoing gaps in care where people didn't know who to talk to for their concerns. Some patients were not prepared, and the number of phone calls to our administration staff was high. This led to delays, misunderstanding, and cancellations. It is well known that people only remember about 15% of the conversation at the consultation. And what are we doing about this? People come in all shapes, sizes, languages, and cultures. Otherwise, we'd all be drinking one type of coffee. Over 400 languages are spoken in Australia and in USA. We need to account for a quarter of our people with different languages and with neurodiversity. Over half the adults in USA can only read up to 6th grade level, and 15% are dyslexic. I question whether these traditional types of communication are still acceptable, and whether the consent process for treatment is truly representative of a system that helps understanding and choice. I think not.
Okay. So just in your own words, tell me what's brought you in today.
Well, I've been getting some diarrhea, really. Yeah, for the last sort of, 2 or 3 weeks.
Let's look at some of the tools we can use to improve the patient's journey. We start with improving engagement at the appointment with Heidi Health or similar AI Scribe. The entire transcript is now documented without any typing. Your communication to other providers is automated, and tasks such as scan requests are automatically filled for you. Using another program, the text is converted with AI into useful infographics that are language agnostic. They will convert to the default language on your browser when receiving the message on your mobile phone. Some of these are pre-filled, so can be sent by anyone on request. Pre-op, preparation, anesthetic, and the procedure are just examples. Now, an important part, we can track the engagement with this, and we can see that this patient spent more time on this part of their journey, highlighting potential need for further explanation. I have just been given a grant to implement this into our hospital, which is a world first. I'm aware a few hospitals are waiting for my trial to complete by the middle of next year. In preparation for the admission, how about creating a character to explain events? It doesn't have to be me. These are all created by AI and can be shared easily to other caregivers. Think grandparents or separated families. One source of truth, no misunderstanding. Language is no longer a barrier. Your parents speak Mandarin? No problem. I'll happily chat to them.
你好，你一定是自豪的祖父母。这种隆起非常常见，且会自行消退，大多数在5岁时就会消失。
Or perhaps an Italian animated character of me. Ciao miei amici italiani, per favore non preoccupatevi per questa protuberanza nell'ombelico. La maggior parte di esse si risolverà entro i 5 anni di età. Or perhaps a different character altogether?
I'm Beck. I'm here to help you with your next appointment. I see you're coming in because of an umbilical hernia. Let me tell you a bit more about it so you know what to ask and think about when you're with the doctors. Sound good? This bulge in the belly button is kind of scary in the first few weeks, right? Don't worry. It often gets bigger around this time. Most of them go away in the first 2 years, and it all looks normal. Hard to believe, I know.
The new storybook feature by Google is fantastic. In 30 seconds, it created this wonderful story for me.
Olivia's Brave Day. Olivia had a big day coming up. Tomorrow was her appointment with the doctor. Thinking about it made her tummy feel like it was full of jumpy frogs. Dad saw Olivia's worried face and sat down close, giving her a warm hug.
Post-operatively, my patients can have a video and voice call agent, maintaining care by my team rather than having to go to the emergency department.
This call will take about 5 to 10 minutes. I want to check in and see how you're doing after your appendectomy on Monday. How are you feeling about your recovery so far?
So far, so good. I'm a little sore, but little by little getting back to my daily routine.
Hi, I hope everything went well yesterday. I'll explain the recovery process and next steps. The wounds will be sore to touch and move, and you can expect some bruising and swelling. This will settle over 1 to 2 weeks. Your child will need some Panadol and Nurofen regularly for 1 to 2 days, then only as required. The latest technology has allowed these AI avatars to become interactive and answer questions. These have my knowledge base from my website.
Yes, hi. My son just had surgery yesterday, and I'd like some information about aftercare, please.
Aftercare is important to ensure your son heals well. Keep his wound clean, watch for signs of infection, and give any pain relief as recommended. If you notice persistent pain, swelling, or redness, call the office right away.
How do I know if it's infected?
If the wound is red, swollen, warm to touch, or if there's pus or a foul smell, these are signs of infection. Also, if your son has a fever or if he's in more pain, call the office straight away.
They have more capabilities than I do. Can you do me a Roald Dahl style poem for my child for their upcoming appointment? Sure. Here's a Roald Dahl style poem for your little one. Little Joe, prepare to go to see the doc, nice and slow. With a giggle, a wiggle, and a brave heart too, you'll be just fine. Yes, you. I think one of the main strengths here is this capability.
这个手术的好处和坏处在哪里？
好处包括预防感染、减少疼痛和不适，也可以改善卫生。批出可能有中章、感染、出血，极少数会有疤痕或痛感。
That is very accurate. Very accurate. And I think this is a very good tool for patients to interact when they could not find a like immediate consultation with the doctor.
Communication is crucial to providing excellent care, so we need a trusted platform. This is a program called Foxo. It is used to help with communication after the patient has been discharged from the hospital and reduces the burden to the emergency department, as most issues can be resolved by answering the questions they have. Pictures of the wound can be shared safely. This is important in my world, where I might have performed circumcision. The last technology piece is very exciting. It's called Nabu. Imagine having all of your own records safely stored in one place. The document received from your doctor is there, and the embedded AI agent can explain it to you and hold you accountable. You can take pictures and videos of things you're concerned about and input your symptoms so you don't forget. It can timeline the events, future appointments, what to bring, and even tell a new doctor a summary of your story. You don't have to be a broken record anymore, and you're safe knowing the software will convey all the salient points of history as well as your concerns. It's time for us to be friends with these new machines and really take care of our fellow humans. Be involved in these conversations now. We must stay in control of this technology. Thank you so much. I look forward to collaborating with you.